Hello, everyone. Good afternoon, good evening, good morning, wherever you're watching me from. Good night to some people as well, wherever you're watching me from. It's a pleasure and an honor to come your way again this evening, this beautiful Wednesday afternoon, late afternoon actually. It's 5:30, so late afternoon. Um, Come your way again on the Real Health Talk. And today I have a guest, and we'll be talking about STIs and STDs. What are the differences? What causes it? How is it treated? Are some treatable? We would get to know all that. So, whilst we wait for my guest, who is actually no stranger to a lot of you that are on social, especially on Facebook, Anita is very, very vocal. You can't touch her and get scot free. Anita will tell you her peace of mind when it comes to her. When she knows she's right, damn, Anita will stand her ground. And she's going to be my guest for this afternoon. And we're talking about STDs and STIs, the causes, the types, preventions, treatables, and everything that goes with it. So whilst we wait for her, just tell me how your day has been. How has your day been? How are you actually? Let me say that. How are you? Because I need to know. It's good to check up on one another, find out exactly how you're doing. So tell me, how has your day been? And how are you doing this lovely Wednesday afternoon? Whether you're in Ghana or you're in UK, America, UAE, how are you? Let me know how you're doing. Let's get talking whilst we wait for Anita to come on. Let's talk. How are you? So if you come on, you can just maybe just say hi. Let me know where you're watching me from. Hi, Annie. She says it's been good, fantastic. My day has been good as well. I've been awesome. It's not too sunny, not too cold. So yeah, it's been good. Mine has been good as well. So let's get talking. Talk to me. Let's know how you're doing, where you watching me from, and please share this link onto your timelines because it's going to be very, very educative and very informative. You don't want to miss out on it. So share it to your screens, share it to your timelines, invite your friends, invite your families, let them come on and let's talk. Let's get talking. It's going to be amazing. You don't want to miss it. So I'm waiting for Anita to come on, and then we'll have a very lovely conversation this afternoon. Now, when we talk of STIs and STDs, what are they? What do they even stand for? I'm not a pro. So let me just put a disclaimer on now so that you know I'm not a medical practitioner. I'm not a pro in that. That is why I have someone come on to talk to us about it so that we get all the gist and all that we need to know. Yes. Okay. So now we're bringing Anita to your screens and then we get talking. Hi, Anita. Can you
Yeah,
hear me?
hi, Sandra. Hi. Sorry, it's I've been
Oh dear.
Yes, I can hear you. I can hear you. My
Fantastic.
network is a bit bad. Can you hear
Oh,
me too?
yes, I can hear you very, very well. I can hear you well.
Good, good, good. My network is
Amazing.
just a bit.
Thank you so much for coming on this afternoon to have this. If your network isn't too stable, we'll try and be as fast as we can so we
Sure,
don't miss out
sure,
anything.
sure,
And I was
sure.
saying before you came on, I said Anita is no stranger to to Facebook screens. Anita will stand her ground as and when she needs to. For those of you who don't know who Anita is, listen, just type her name in your search engine. Just put on Facebook, just put Anita as someone, and it will just come on and it will tell you who she
Um,
is. and no
I think you have
nonsense.
to type in. You have to add the my initial
The
Anita
E, all
E
right,
Asamoah.
Anita
Yes,
E
the E has
Asamoah.
to. Yes,
Yeah,
it
she
has
has an
to.
E as well in there, and it will tell you everything about her. Man, you
Yes.
don't mess up with Anita and go scot free.
Oh, why? I don't like. I
Oh
don't like
dear.
violence. So I'm a gentle girl, Charlie.
Okay. Oh, no, that's okay. We believe that, don't we? We all don't like violence, but once a while you need to just shake yourself a bit, like Emma would say, for shaggy reasons. You just need to let people know they can't take you for granted, and I like that
Yes,
about
yes.
you.
Thank
Right,
you.
Anita. I know a lot of people know you in Ghana, especially because you've been on national televisions, you're on the radios and all that, and please let those of us who don't know who you are tell us a little
Okay.
bit about yourself.
Oh, okay. So my name is Anita E. Asamoah, and um, I'm just your girl next door. But I love um, public public health or health advocacy. I love mentoring the youth as well, adolescents, teenagers. I do a lot of research work as well. I work on the field most times, in the communities, rural communities mostly. What else? I think I do a lot. I do other, you know, part-time businesses to to make
Absolutely,
ends
it's
to make
important.
ends meet. Yes. So I do so many things aside the main research and public health thing, and research. I think I mentioned research. I do a lot of other things, just to get some money. So that is just about me. Yeah.
Fantastic. That's so nice to hear. I love women that do other things just to get going. It's important that you're always busy. Not busy for nothing,
Thank
but
you.
busy making an impact. Now, Anita, this afternoon we're just talking about STDs and STIs. Since
Yes.
that is your area. I said it is not my area. I put a disclaimer before I started. I said I'm not a medical professional. I'm not a medical practitioner. That is why we bring people like yourselves on to talk to us, so that in the layman's world we get to gain knowledge and understanding
Mm, yeah.
from your side. Now let's talk about it. What's the difference between STDs and STIs, and what are they actually?
Oh, okay. So um, when you put the D, which is the diseases, that means it is a group. So it could be yeast infection, gonorrhea, syphilis, HIV, chlamydia. All those grouped together make up STDs, sexually transmitted diseases. But then when you say sexually transmitted infection, so it is just one. So maybe you contracted maybe syphilis or gonorrhea, then it's an infection. It's a sexually transmitted infection. So it is one. You get it? So, but then you can also say infections. I mean, which refers to others included. But then with the diseases, then different types of sexually transmitted infections would make it up as diseases. Yeah.
Okay, so the infections make up the
Yeah.
diseases. So the
Yeah.
STIs
Yeah.
bring about the STDs. All right. So now we know.
Exactly. Yes.
Okay,
Yes.
fantastic. So guys, put that in mind. There's a difference between the STIs and then the STDs. We had to actually differentiate that so people get to know what it is. Now, so the STIs are like viruses and bacterias and fungus and stuff like that, isn't it? That's what makes up the infections.
Yeah. Yeah. Yeah, all
Fantastic.
of them. Either it could be viral, it could be fungi, it could be, yeah. So all of them, because we have viral infections as well. We have bacterial infections as well. We have fungal infections too. So yeah.
Okay, so are they all like the bacteria, the viruses, the fungi? Are they all through sexually transmitted, or are they all through sexually transmitted, or you can get it outside of that?
Oh, not all are sexually transmitted anyway. But when we say it is sexually transmitted, then those ones are particularly transmitted. When we say sexually transmitted, then those particular ones are transmitted by sex only. You get it? Now,
Mm-hmm.
I may be HIV positive, but then maybe my mother was positive, so I was born with it. You see,
Mm-hmm.
it wasn't through sex. Uh-huh. So I could also have some maybe UTI or whatever, or maybe what we generally refer to as the whites. It is an infection also which can be got sexually, but then ordinarily too, as a woman, you can your vagina um
Yeah. So what we
a
call like
pH,
yeast infection. Yeah.
yeah, your vagina pH may change maybe because you inserted what you're not supposed to insert in there. You see, it can also make you have infection, but that is not sexually transmitted, you see. So those particular ones that are referred to as sexually transmitted are contracted through sex only. Do you get
Hmm.
it?
Yeah.
Yeah. Now,
Okay.
for example,
Mm-hmm.
for example, herpes is can be transmitted sexually. It can also be non-sexual. It is a
Okay.
viral infection. Yes. So for that, you would see that sometimes with the kids or children, even you, the adult, you see some group of sores around your lips,
Yeah.
and
Which we
you
call
would
like
think you
cold
have what you
sores.
call fever, cold sores, and you'd say, "Oh, I have fever."
Mm.
They are viral infections. So some, I mean, it is said that we all have it at a point. You get it. When you have it once, it's just manageable. You can manage it. It has no cure. But then it may not be sexually transmitted.
Yeah.
You could kiss the person and contract it.
Mm-hmm.
Uh-huh. You could also give a blowjob, excuse me to say.
That's fine. Go on.
you
That's fine.
could you could suck the male penis or the your partner's vagina, and
Mm-hmm.
if he or she has them, you may not, maybe it wasn't visible to your eye, you can contract it and it would show on your lip first. Sometimes if it is on your genital, then you see them maybe as a pimple, you may think it is a pimple. So
Mm.
you see, it can be sexual and non-sexual. So some of them are like that. Yeah.
Wow. It's good that you're explaining these, because I'm sure there
Mm.
may be some people out there that may have a partner that probably has a yeast infection or has a cold sore, and then they might jump to conclusion, hey, I think you've gone to sleep with somebody else and you've got it and you're bringing it home, instead
Oh
of,
no,
yeah,
no.
instead of
Mm.
them knowing that there are times where, especially as a woman, your pH level, like you said, changes, and so you're bound to have like a yeast infection, which is treatable, and that is not
Yes.
a sexually transmitted disease, an infection. Actually, let me use the word infection. So now break them down for me. You talked about chlamydia, you talked about syphilis, you talked about gonorrhea, you talked about HIV, and break them
Mhm.
down for me, please. What are some of the signs that one needs to watch out for if, let's say, you have gonorrhea, you have syphilis, you have chlamydia? We've
Okay.
heard the name, but we
So,
don't know what it is.
oh, so I would, yes. So I'm like, just like you said earlier on, I'm not a prescriber. So um and also I'm not a clinician. Okay, so I am not saying if you see this thing,
Yeah,
then
yeah, we're putting a
exactly
disclaimer on.
it
Exactly.
is, yes, it is gonorrhea. No.
No.
But then, for example, with the males, definitely you may have difficulty urinating and you may have pains when urinating as well. Even with the women, some infections, you would see that even with UTI, which is a urinary tract infection, you would see that when you are peeing, you would feel some hotness, down
Mm.
there. It is an infection. Sometimes it could be inflamed. That's a part of the labia, the outer part of it. You see that it could be inflamed. It is an infection. And it doesn't mean that every inflammation or maybe any pain whilst urinating is a symptom of gonorrhea. It could
Mm.
also be something else knocking on your door. So even cervical cancer, you may start having pains or spotting. You get it? Like
Yeah.
as if maybe you're having your period. Yes, but
Mm.
it could be cervical cancer knocking on your door, telling you something is going on in there. You are not on your period, but then you can see you are spotting. You see, you have to go to the hospital. And that is why we always say that any of these symptoms, please do go to the doctor. Do not
Mm.
go and self-medicate, or because your friend once told you that they had gonorrhea or syphilis, and
Mm-hmm.
then he told you that, oh, maybe I don't want to name brands of any
Yeah.
medication,
Yeah.
antibiotics. Mostly they abuse the antibiotics like that. And then you took that and then you swallow. No, at the end of the day, if it is not that particular STD or STI, for instance, if it is not the gonorrhea, you are harming yourself because the medication you are taking can harm you. You see,
Yeah.
so you are causing more harm than good. But if assuming immediately you saw the sign that when you are urinating, you are having pains, or maybe when you saw the rashes on your skin, for some time now you've been seeing rashes on your skin, you've been falling sick. Instead of you to go test for HIV or whatever, you are just taking some herbal leaves or drinks or concoctions. You see, it wouldn't help. Because if assuming you had gone to the hospital immediately, the
Yeah.
doctors would test. You
Yeah.
see, and then when they test, when they run some series or a series of tests, then they will know that this is the particular infection or disease, sexually transmitted disease that is worrying you, and then they will give you the right treatment. But if you
That's
go
so
buy
true.
antibiotics, then go and buy Cipro, they buy a whole lot of things, and you take yourself, you're harming your system because you're harming your kidney, you're harming your liver.
Yeah.
Okay, and even that infection is not going to even go off because you're not treating it. What the Twi people will say unto us here,
Yeah. It
like,
hasn't
do you
been
get it?
uprooted.
It
Yeah.
would have just slight effect on it,
Yeah.
you see, and then to be as if say it's cleared off, but then it is there, and before you know it, it could probably lead to infertility for
Yeah.
some for you, you see. So that is the more reason we want you to go see the doctor and test to be sure of the particular type of infection that you have. Yes, that is it.
Okay.
So
So
for the
go on.
symptoms you are saying, it could be rashes, it could be the cold sores, it could be pain whilst you are urinating. For some too, it could be a pimple around your genital. For some, um, which other common symptom? Yeah, so it could be a pimple around your genital, and for some to discharge for the women, you could be having discharge, which is not the normal discharge you would see on a good day. The scent, the smell of it, you get it. So if it is getting to a point that it smells like rotten egg, then you know that it is like at the last
An
stage.
infection.
So
Mm.
immediately you see that your vaginal flora is changing, or the scent is changing. It is not like as you used to say it, then you should go see a doctor. If you can't see a doctor immediately, if you talk to a nurse also in the hospital, they would tell you what to do. But then if you are in a position to go to a hospital, the best thing is to go see a doctor and they test you to ascertain the exact infection or disease that is worrying you.
Wow, fantastic. Thank you so much. Now, is there a cure for all STIs?
Okay, some are curable if you um, are able to see it on time. Some are manageable. So for some, they will be there, like the viral ones, they are not curable. So you just manage them. So like HIV, you won't get a cure, but would manage, the clinicians will manage it. You'll be on medication. And when you're on ARVs, it will get to a point, if you are taking your meds seriously, you won't test positive for HIV. And that is why you
Okay.
see some people say that, oh, I had HIV, and yasame yare. No, it is there. It is because you're virally suppressed. You're taking your meds seriously, and so you are negative. When you go for test again, it will be negative. And so we have some of our HIV people or persons who test negative because they are religiously taking their meds. You
Hmm.
see, so they are managing it. It is not a cure. So don't let anyone deceive you that when you have HIV, there is a cure. Don't let any pastor tell you that there is a cure for it. And prayer and fasting, and then there is a cure. It is a lie. You get it. And then for some of them, they have treatments. It would clear off. Gonorrhea and the rest of them, the yeast infections, if it's UTI, whatever it is, those ones, they can be treated and they will clear off from your system. But then, if you know that you are treating STI and the doctor has told you this is what we are treating, definitely you will know. Please be sincere and don't go sleeping with somebody.
I was just
It
about
even
to say
doesn't
that.
help
Thank you
you.
for bringing that up.
It doesn't help you, the person who is on treatment for it, because you've
Yeah.
not completed the course or the dose of the medicine the doctor or the clinician has prescribed for you. And then
Hmm.
you are sleeping with your girlfriend, you are sleeping with your boyfriend, you are harming them. You get it? You are harming them. It is not nice. A lot of people have these diseases and then they pretend, and then they won't use condoms because their girlfriends are unsuspecting, their boyfriends are unsuspecting, their wives are unsuspecting, their husbands are not suspecting them. So, they will be treating it silently. Instead of to abstain from sex for that period, they will still be sleeping with their wives, sleeping with their husbands or boyfriends. You see, it's not nice.
It's not nice, says Anita.
Yeah,
Be
we are
honest
not being
and
honest with each
sincere with
other. Yeah.
yourselves. It is not
Mm.
nice. You don't want to put somebody else in that uh, problem that you are in. If you know that you have a disease or an infection you're dealing with, it is better to treat yourself than to infect somebody else. And I think that those that, like Anita was saying, you haven't actually finished the course of whatever was given to you. And so you're rather harming yourself than doing yourself good. So make sure that your course is finished, you are on top of things, and stay true to yourself instead of going about distributing your disease and infections. Listen, Anita is at work. And so you can see she's moving up and down and she's talking to people because she's still in the hospital, she's still working. So we won't take too much of her time, but we will just dive straight into it. When she finished talking to her colleague, we will get her back on. And so please, if you've just joined us this evening, we're talking about STDs and STIs, and Anita has explained a lot the differences between the STDs and STIs and what they are. And she's mentioned a few of these infections. She's talked about the gonorrhea, syphilis, chlamydia, and all that. She's talked about a few. Now, there are also UTIs, and I want her to talk a little bit about UTI and how we get these UTIs. And UTI is a urinary tract infections, and I think a lot of women actually tend to get that. For me personally, I hardly, don't say don't, I hardly use public toilets. I hardly use public toilets just because I want to avoid all these kind of infections that So let's get back to Anita, because I think she's finished talking to her colleague, and then she can talk to
Okay.
us about UTIs. Let's go on to UTIs. Now,
Okay.
someone just sent me a message. It says, can men also get UTIs? That's my first
Please,
question.
yes. Yes. Oh, they can. So that is why I say any symptoms you get at all, please do go to the hospital. I beg you. You see, men can also have it. You see, and then with the men, they always think that, oh, men, minyoba, I mean, infections, and to say, we are not like the women.
Mm,
No. And so you see, they harbor it and they will be spreading because maybe they are not seeing any symptoms yet, but they are
yeah,
spreading it. So please, men also do, you see, and that is why if you have a partner and you treat something, it is always better the two of you go to the hospital, and even the doctor will tell, the clinician will tell you. Like I said, I am not a clinician. When you even go, they will tell you that bring your partner, you see, and then they will test them also and put them on treatment. If it is something they don't have to test them, they will put him or her on treatment too. Yeah, to help each other as a couple. So those
yeah.
of
So that you don't
you
you don't
who
cross
are
cross
in,
infect
yeah,
each other. Mm,
exactly, those that are insincere with their partners, especially unfaithful, and they are not protecting themselves with condoms when they sleep out.
mm.
Please, you are exposing your innocent spouses to infections. Yes. So
Okay, so
please,
Victoria says more on UTI. I had it when I was pregnant with my two. Is it second
oh
or second
yes,
pregnancy, and I
yes.
lost
When
a
you're
child.
pregnant,
Yeah.
yeah, with
So more on
pregnancy,
UTI. So please let's talk
because
about it.
of because of the way our body changes when we are pregnant, you see your your even inside your vagina, you see that sometimes it's the color changes, maybe from month to month, the amount of discharge changes. When you talk to the midwives, they will tell you. So with pregnancy, your hormone, because of the hormonal changes, you will see some certain changes, and you may frequently treat UTI, you see. So that is, it's not nothing bad. When you go to the hospital, even at the antenatal unit, when they tell you, they themselves would ask you, and then they would give you medications for it. And that is why always the pregnant women have to go for the antenatal to get their routine tests, and medications. So for the pregnant women, it is nothing much like that, especially when you are pregnant. You can easily get infected, so there is no panic for that, because you are pregnant, your immune system is low, you have a baby in you growing, you see. So don't panic at all. If you're pregnant and you have it, just go when you go for antenatal, you complain to the doctor, and you will be given the right medication. Yeah.
So can UTIs cause miscarriage? Can it cause you to miscarry when you're pregnant?
Oh, I doubt it. Except no, 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 no. Except maybe you had it and it's been there untreated, and maybe at the early stages, but then a growing pregnancy that it would make you, have miscarriage like that. Oh no, it's
Okay.
no, no.
Okay. So let me talk about UTIs. Can we? I mean, how? Okay. How does one get a UTI?
How one gets UTI?
Yeah.
Okay, so one, we sleep with each other. Pass it. We exchange body fluids. You can contract it from your partner, but then also sometimes it's just within you. It's natural. Your system changes.
Okay.
Sometimes, I won't say what they call the toilet infection there. No, there is nothing actually like toilet infection. You have infection, you have infection. It's not like maybe it's from the toilet. But then your body can change also, and you would get it, not because maybe you slept with someone, but personal hygiene also, your own personal hygiene. how you keep your panties, your boxes. Uh-huh. But then mainly because we exchange body fluids when we sleep or have sex with each other. So we are likely to, get it. So it's nothing much because it is treatable. But not because it is treatable, then you expose yourself and
Yeah.
be promiscuous. No.
Mhm.
Uh-huh. Yeah.
Okay, so how does one get yeast infection?
So the for that, for some people, some claim that, oh, when they eat a particular thing, it changes their vaginal pH and then they have yeast infection. But no, it is an infection. It is an infection. You can get it from your partner, like I said. You can also get it by, sometimes you insert your hands down there. Maybe you share, maybe sex toys, um, things like that. Sorry, please.
That's okay.
Okay, so things like that can expose you to it, but mainly it is an infection and you would contract it from your partner, mostly. Mostly.
Okay, I have a question here that says, my daughter is only
Also,
3 years, but she's had a number of yeast infections and UTI. What do I do about it?
sorry, please repeat your question, please. Oh,
She
sorry.
says her daughter is 3 years. She's had
Mm-hmm.
a couple of yeast infections and UTIs. How does she go about it?
Uh, is it, does she still wear diapers?
I
And
I don't
aside
I don't
that,
know. So if
she
you're
has to
please,
see the
if you're listening, just
pediatrician.
send me back the message. Does
She
your
has to
daughter,
take
does
the
your
child to
child
the
wear
pediatrician.
diapers? She said no.
Please, she has to take the baby to the pediatrician, please, because that is serious. So is it that when she's peeing, she's having pains? The baby tells her she has pains when she's peeing, or what? Is it that there's an inflammation there, down there, and please, she should make sure that, hope nobody is molesting the girl, fingering, or abuse generally. So please, she has to really find out. But the best thing is to go see the pediatrician, please, ASAP, immediately, please.
Okay. Okay. She
Immediately,
says
yeah. Yeah.
she itches a lot and her panties.
Uh-huh.
Okay, so it's like the itch and
So
then the
please,
discharge.
also the body personal hygiene should increase. Change her panties regularly, bathing her, make sure you clean the down there well. But then don't insert anything for her. Just you use soap and water and the sponge and make sure she's clean. And make sure you change her panties. I don't know if she still wears diapers.
No, she
That
said
could also
no.
cause some irritation. So if no
She said
diaper
she
and
doesn't wear
she itches
diapers.
down there, often, and I don't know if maybe there's discharge or not, but
She said there's
please
discharge.
go.
Yes.
Yes, please do go to the hospital, please, ASAP, I beg you, so
Hmm.
that you wouldn't this child as a girl wouldn't have other problems develop from that, please, and it would affect her later in life. So please kindly go see a doctor or a pediatrician so that they can know what exactly is wrong with the baby, the child,
Okay.
because he's still
Thank you
very
so
young.
much. And he says the Ghana mothers will put ginger.
No, 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 please. Yes, the ginger, the akikado na yedichiano there. Please, it won't cure any infection,
Okay.
and moreover, inserting those things can harm the child. You can break the hymen of the child, and the child won't even, what you say, virgin thing, she wouldn't even be, because you had even inserted your hand and the ginger and stuff before she even grew up, you see.
Hmm.
So please ask for that. No, you don't insert anything in there, both as a child or as an adult. You don't have to insert anything in there.
Fantastic. Okay. You know what? You know where we were actually talking about STDs and STIs, but it looks like it's actually shifted to UTIs now, because it looks like the a lot of the women want to know more about UTIs. Okay, so another question is, if you
Yeah.
have just one sexual partner and
Yeah.
the partner also claims you are their only sexual partner, how can you get how can you get an SDI?
Your partner claims you are their only partner,
Mm-hmm.
and now you have an STI. Oh, so what kind of infection is it?
I don't know.
If assuming um, it is maybe say gonorrhea, then you definitely know that it is a lie. The
They're
person
lying.
has other
Mm,
partners. If
mm,
assuming it is HIV, you definitely know maybe the person contracted it before meeting you, but they had not tested and they didn't know their status. Some also
right.
know and lie. They will be on the medication and they won't tell you, especially for the HIV. So it depends on the kind of infection or disease, sexually transmitted disease. But then also, if the person tells you that you are their only partner, then I doubt it that they are going to, infect you with any disease, or infection that
Okay.
he or she didn't know about earlier on. Just like that, and then I have, gonorrhea. Just like that, I have HIV. Except
Chlamydia. She says
maybe
she has
now,
she has
for instance,
chlamydia.
HIV. For instance, HIV, you may say that, oh, maybe I used a needle. Maybe if you're a medical health worker or a
Mm,
clinician, that is, as we can understand that. But even that, please, don't let anyone deceive you that you are their only partner. People lie.
mm,
People lie a lot. It is all lies. They have other people they are seeing. So it is up to you to, to protect yourself. But husband and wife, especially, if you know you are cheating or unfaithful, then please protect yourself so that you protect your spouse.
true.
You see, yeah, because at the end of the day, you can't tell your spouse that um, they are the only one you are sleeping with, and then you had gonorrhea, and then you had no. Syphilis. It doesn't add up.
It doesn't add up.
So
It's true.
So please protect yourself to protect your own spouse and family. Simple.
True. Protect
Yeah.
yourself and protect your family. Now, another question. I think I'm only getting questions for you today. Well, it's good because you're also giving us the
For
answers.
it.
It says,
Let
can
me check.
SDI be permanent? Or is an SDI permanent?
So sorry, please.
She says SDI. It says, can an SDI be permanent?
Yes, I told you that there are some that are only managed.
Yeah.
Some are treatable. Yes. So some are permanent. It will be there. So maybe it will be sometimes it will reoccur when maybe your body is stressed. You see, so that is it. So for some of them it is management, so it is permanent.
Says it's
Okay.
for some of them it is
Uh-huh.
management. You got to live
Uh-huh.
with it.
Yeah, you have to
Damn.
live with it. Yes. We are managing it. The clinician, the doctors, and the clinicians, they will be managing it for you. You'll be going for drugs or medications, stuff like that. But for some, they will treat it totally, and then you have to protect yourself and be careful how or who you sleep with. Yeah.
Okay, I think that it's a similar question again, but then Anita has actually answered that for us already. She says, well, if one contracted an STI when they were young and now they are old,
Yeah.
will their infection still be there? And I think you've answered that already anyway. So um, uh, it's more of they knowing that the STIs are there, or and Anita, I think you should actually tell people to just go get checked if they don't know they have it.
So I think what she's trying to say is, if assuming you had an infection when you were young,
Mm.
would it still be there when you grow up or something like that?
Yeah. Yeah. Sort
Now
of.
it can. If
Okay.
assuming you had an infection you didn't treat as a woman or as a man, it can develop into, when you were younger, before you got married, it can develop into what we call PID, and then it will affect your fertility.
Right. I was
So
just about to ask you
you
that,
are
and
you are
I'm glad you
grown
brought it up.
you are grown now, but then the repercussion is what is happening to you because you didn't treat it. You saw
Yeah.
the signs or symptoms then and you ignored, or you treated yourself, but then it didn't actually, I mean, get treated, or wipe the whole thing away. It was on the surface, you see. Then the bacteria or the virus will get stronger with time, and then it will develop into the pelvic inflammatory disease, and then you may have fertility issues later in life. So you see, it is because you didn't treat it, or you didn't go to the right person, the doctor, to treat it for you. So you see, you got it whilst you were young, but now
Yeah.
it is affecting you. Yeah.
I was actually going to talk about that and ask you that, and so I'm glad you actually brought it up that a lot of
Mm-hmm.
women have PIDs that they don't have any clue about. They just go about thinking that they are infertile, but they didn't know that it was probably through this kind of
Exactly.
stuff.
Yeah.
That,
So a lot
yeah.
of women are infertile, but they didn't know it started from an infection some boy be they were dating when they were younger,
Mm-hmm.
because
Mm-hmm.
both of them were not treating, they didn't treat the infection when they saw the signs,
Yeah.
you see. So so you grow up with it, and then it turned into something else, and then now you are having fertility issues whilst you are married. Yes. Yes, some with treatment. When you see the gynecologist, they have procedures they may do for you. They may clean your tubes. HSG is there, a whole lot. They may put you on certain medication that would maybe boost your fertility. But then some also, if they are at the stage where nothing can be done, nothing can be done. You get it.
Damn.
Uh-huh. Yeah.
Prevention, they say, is better than cure. Protect yourself.
Exactly. Exactly. So, like I said earlier on, we issued a disclaimer because we are not clinicians, and
Yeah.
it is awareness we are creating. I'm a public health advocate, and we are creating this for you to know. Not that's why I don't want to mention any symptom, any medication, anything. The doctors are there to do it for us. That is their job, and that is why
Yeah.
you have to go. You don't have to go and take any herbal concoction that it will clear the white, it will clear the this, it will clear. No, 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 no. You are
Yeah.
harming yourself more. Do you
Absolutely.
get it? Uh-huh.
Listen, Anita is still working. You can tell she's still in her office and she's talking to colleagues here and there. Anita, we don't want to take too much of your time. I've got two questions I want to ask you. Well, not for me personally, but it's people's question. And I just want to ask that, and then we can let you off because we started at 5:30 and we've got 10 more minutes and then we're done. And so when Anita is done, okay, she's talking to her colleague now. So when she's done talking,
Okay,
we
so
can ask her.
sorry. So
That's
let's
fine.
go on.
We
Yeah.
know, you're still working. We understand. Now, I've got two
Sorry.
questions here in my inbox that I want to ask you, and
Oh, okay.
one is what is the worst form of STD, and then two is can I get STD from kissing? So those are the two
Oh,
questions, guys. You can leave your
the
questions in
worst
the comment
form.
section. Anita will
Well,
come
I
back
would
to it
say,
later.
would I say there's a worst form? Well, I wouldn't say a worst. So which one is worse? Is it, would I say it's HIV, or will I say, oh no? I mean, these days, because we have people living with HIV and
Mm,
we want them to come to the clinic, we want them to be in care, we want them to be taking their medication. So we don't want to stigmatize against them. And so I
yeah,
won't say it is the worst, because there are meds for HIV even now. You get
yeah.
it. It is not a death sentence. So I won't tell you that HIV is the worst. No. What about hepatitis? You can contract it sexually. You get it? Hepatitis. But some people don't know, you see, and it's a viral infection, you see. So some of these things, it is just for you to be careful. I won't tell you that is the worst form of a disease to happen to you. No, no, I won't tell you that, because if assuming you are HIV positive, then you feel bad. Oh, I have HIV. No, I tested
Yeah.
positive for HIV, and then you are hiding it, and then you won't come to the um, ART center to take your medication. No, it is not going to help you. We
Yeah.
want you to go, yes, we want you to visit the clinic and come for your meds, you see. And also, even if you have any form of infection, we want you to come see the doctor, they run tests for you, and then you are cured or you are treated. Or if it is the one that can be managed, it is managed so that you protect your family, you protect your wife, you see. So
Absolutely.
I won't say that one particular disease is the worst to happen to anybody. No, I won't say that. But then he says, can you contract infection from kissing?
Listen,
Yes,
yeah.
you can. You can contract some infections from kissing. So if the down there is not hygienic, you are sucking the person, you are sucking the penis, you can. You get it? So you can. And that is
Okay.
why, I mentioned earlier on the cold sores you see. And that is why I would also say that aside being careful, sometimes with new partners, sometimes when you okay, sometimes I'm back. Sometimes when you have new sexual partners, I would say that um, even if I test each other, go to the clinic and test. I know it is difficult for Ghanaians. They don't like it. The moment you mention to a man that we should go and test before you even get married, they get angry. A lot of them, you get it. They don't like testing. So it is a problem. But then I would say that if you know the person is a new partner to you, make sure that maybe the light is on when you are having sex so that you see what is there.
You see what
You
you're
get my
getting.
point? People switching off the lights whilst having sex is not, to me, these days, it is not safe.
Oh, we've lost Anita. Oh, damn, 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 damn. Just when the conversation was getting hot. I'm sure she's going to come back to wrap up. She says, these days, you've got to keep the light on because you don't know what you're getting yourself into. So please, she says, when you're having sex with a new partner, do not switch off the light because you may never know what you're getting yourself into. And we had it. I was going to ask her a final question that Annie posted, but she's gone off. Hopefully, she would come back and wrap it up for us. If not, we would have to call it a day. But it's been very interesting. It's been very informative and educative as well. So, guys, if you if you didn't watch from the beginning, I would um advise that you do that. Just go back and watch the replay, share it on your timeline, share it to your friends, let them get all this information that we're giving out. And it is for free. We're just sharing this for free. And Anita is into all these research stuff that she does. She will tell you she's not a clinician, she's not a doctor, but trust me, she is into community health. So she knows everything that to do with all these bits and pieces. And she wrote a very lovely article on WordPress about STDs and STIs a while back. So you can go back onto that and read it. She's no stranger to a lot of you in Ghana because she's been on the television and on the radio stations a lot, advocating against all these community health stuff. So, guys, if Anita doesn't come back within the next 2 minutes, we would have to wrap up. And I'm sure you've all had an interesting time with me talking about STDs and STIs. Listen, I said before Anita went up that prevention, they say, is better than cure. Protect yourself. Be true to who you are. Be true to yourself. Be true to your partner. Be true to your spouse. If you're married, multiple sexual partners doesn't help anyone. Having 1,000 body counts doesn't make you any better than having one person. It rather spoils a lot of things in you, even than even being more of, I don't want to go into the spiritual side of it, but hey, don't put yourself out there. Don't open up yourself to all this mess. Had I known, they say, is always at last. You don't want to say, had I known, I wouldn't have gone to this lady. I wouldn't have gone to this gentleman. I wouldn't have gone to sleep with this guy or that lady. Protect yourself. Protect who you are. There's a lot in you. Protect it. Your destiny shouldn't be cut short because of a wrong person you went to sleep with, or a wrong man or wrong woman you went to sleep with. Protect yourself. Be true to yourself. Be honest to yourself. Value who you are. You're worthy. Right. Anita is back. So we'll just wrap up and then we would go off because Anita, I know you're busy.
Okay,
Final
yeah.
question.
So can you hear me, please?
Yes, I can. I can.
Can you hear me, please?
Yes, I can hear you, Anita. I can hear you.
Hello.
Yeah, I can. We can hear you, Anita.
It's here 100,
Anita, we can hear you.
59. Let me edit this one.
Anita,
CHNTSC 10 TSC 101
Anita. I think Anita is having issues with her internet. Right. Um, she might probably. Oh, okay, she's back. Oh, she's gone off again. Oh dear. All right. We'll just give Anita a minute to come back on and then we will call it an evening. It's been interesting having you all on board and with all your questions you're asking. Listen, if you have any questions when you watch this on a replay, if you don't want to leave your questions in the comment section, what you can also do is like what others have done this evening, you just send it to me in my inbox through Messenger, or you can do it directly to Anita, and her Facebook handle is Anita E Asamoah. So there has to be the E, if not, you might miss her. I think there's a few of Anita Asamoah's on Facebook, so she says hers is with the E. Okay. So we're bringing Anita back on. Can you hear me, Anita?
Okay, so good. Can you hear me?
Yes.
Okay, good. So let me wrap up because of the network. Okay, so basically the last thing I said was that yes, you can get a few of the infections through kissing. So let's be aware of that. Like the herpes, you can, and that one, when you have it, it's under your skin. It is there forever. Sometimes when your body gets stressed, you would see that maybe it will come out as maybe cold sores on maybe your genitals or on your skin or maybe on your lips. So I mean, it is there. You get it, and you live with it. A lot of people have it, but there are types of HSV. We have types of it. So
Oh, I think Anita's network is just trying to mess her up when she's trying to wrap up. But hey, like I said, if there are any questions that you want to ask um, Anita when we're off air, you can still do that. Just inbox her, and please be polite. Because with Anita, I keep telling you, she's a no-nonsense person. So when you go into her inbox, just go straight to the point that you watch the live or you watch the replay and you want to ask her X, Y, and Z. Just go straight to the point and ask her. Because you don't want to need Sorry about that. I think you lost me as well for a minute, but I'm back. Just to wrap up for this evening, listen, it's been an interesting evening of talking to you about STDs and STIs. And I've said it so many times, I'm just saying it for the very last time. Prevention is better than cure. Protect yourself, protect your families, protect your loved ones. Stay true to yourself. And any you ask the questions, can one get oral cancer from oral sex? And I think that we would leave that because I'm not sure we can get Anita to come back on, and we would ask this another time, or she can just come back into Facebook and answer this for you. So listen, you all have a very lovely evening. Take care of yourself, protect yourself. If you're having UTIs, go to the hospital and get checked out, get right medication, treat yourself, keep your hygiene on point, and make sure that you are clean inside out, and stay true to yourself. Life is for living. Don't waste it on STDs and SDIs and fighting one infections after the other because you're being promiscuous. Take care of yourself. Enjoy the rest of your evening. And until I come your way again next time with another episode of the Real Health Talk, the Lord bless you and keep you. The Lord make his face to shine upon you and be gracious unto you. Go through the rest of the week with the confidence and assurance that greater is he that is in you than he that is in the world. The Lord loves you, and so do I. Have a beautiful evening. Bye bye.